Hi, everybody. My name is Michael Romita, the President and CEO of the Westchester County Association. Thank you for joining us today for this important video chat. This week, Westchester and the lower Hudson Valley takes an important first step. If you've been watching County Executive Latimer and his press conferences, yesterday he was joined by the head of economic development in the county, Bridget Gibbons, and they talked about how Westchester can get back on its feet, and it's going to be a process. But this week, the governor lifted the New York pause order for the Mid-Hudson region, and non-essential businesses can get back to work. How responsibly we undertake this process will have a dramatic impact on how quickly we can start to rebuild the local economy. With this in mind, the Westchester County Association has convened a post-pandemic working group of business, educational, and nonprofit leaders to address the long-term systemic challenges and opportunities created by the pandemic. Today's program is the first in a virtual event series on Reopening Westchester, and this is the post-pandemic working group's first initiative. Future programs in the series will address topics such as reimagining the workplace environment, the expanding role of technology in Westchester, and the crucial importance of nonprofits in rebuilding the economy. Today's program will provide practical advice on how to reopen your business while keeping the health and safety of your employees as the first priority during this unprecedented time. You will hear a case study of a business that's already reopened and what they have learned so far. At the end of the program, we'll present a survey to you. It's a few simple questions. It'll take about 2 minutes, and I hope you'll fill it out so that your voices can be heard. One piece of housekeeping. This is an interactive participation exercise. If you have questions, please use the Q&A function on your Zoom video screen and do not use the chat function. Our event sponsors today will scroll through. I think we have some scrolling. There we go. Thank you to all of them for helping to make this possible. At this point, I'd like to introduce County Executive George Latimer, whose steady leadership has helped Westchester fight the spread and transition from one of the epicenters of the outbreak in early March to this week's reopening of the regional economy. George, thanks for joining us today.
Michael, it's a pleasure to be with you and all my friends and colleagues from the Westchester County Association and other visitors online. We're obviously dealing with something that we've never dealt with before. All the phrases are now cliche about this being uncharted waters and no roadmap. Briefly, we got to the point where just about 3 months ago, we had our first case of COVID-19 here in Westchester County. It was a celebrated case of an individual who became known as the index patient, and around whom something to the tune of about 100 positive cases developed from the interactions he had just over a weekend at some community events in his house of worship. And from that point forward, Westchester became seen as the first place, ground zero, if you will, for this outbreak here in New York. Now, from first, we've certainly not been the worst, and we saw our worst days at the very end of March and at the beginning week of April, where we went on that bell curve up very steeply from that first case up to having 12,000 active cases. Now, we've tested people, and to date, we've had over 34,000 people that have tested positive for COVID. But most of those people have gone through the 2-week incubation period. They have, fought off the disease, did not get sick. And so in terms of active cases, we've gone from that peak of about 11,000 active cases to about 1,600 active cases. And that's a diminution over the last 7 weeks. In the last 7 weeks, we've had a drop in hospitalizations, which peaked at 1,200 people in the hospital, and now is down approaching 300 and will be slightly under 300 on any given day. The number of people who have died is obviously an accumulative number, and it's a significant number. 1,300, almost 1,400 people that were alive on March 1st are now deceased. However, the overnight fatality rate now, in the last number of days, last week, 10 days, 2 weeks, have been single digits, 2 people and 3 people and 6 people. We had, back in that first week of April, 45 people die in a single night, 50 people die in a night. That was the largest peacetime fatality that Westchester has ever seen, at least in recent memory. So we're sobered by what we saw, and we certainly, as we start to reopen the society, we don't want to go back to that. And that is just a very practical reality. It is bad for business. It is bad for our society and our culture to have the death rate peak in that fashion. And Westchester County is 1 million people strong. We're people who travel. We're people who are involved in business all across the world. And so in some ways, I shouldn't be surprised that we were one of the first places to be hit by this virus. But as we work our way back within the constrictures of the state policy, we're trying now to get back to something that, if it isn't normal as we knew it in February, it's a new normal that still allows us to start to grow and return to our business functions. The governor established 7 metrics that the Hudson Valley region met officially as of yesterday, which relieved us and put us into phase 1 of the reopening of our area. And it's not just Westchester alone. It's Westchester, Putnam, Rockland, Dutchess, Orange, Ulster, and Sullivan counties. We were the last region north of New York City to come online. All of the other upstate regions, I think they've divided upstate into 7 regions, had all come online prior to us. And I think today, a day after we came online, Long Island is now online, leaving, of course, the city of New York as the last biggest mountain to climb. And of course, New York City is a very complicated place to operate in. And the success of New York City is essential to the success of Westchester, since 200,000 of our residents commute every day into the city to work, as I once did myself every day. But where we are now in phase 1 is really, as Churchill said, the end of the beginning, as opposed to the beginning of the end. We now have open, as of yesterday, construction projects around the county, not just essential construction. Essential construction continued on. A case was made that someone was building a wing to a hospital that was essential. But now we have many of the developments, a lot of the residential developments going up in Westchester County based on transit-oriented development that now can resume their construction. And that puts back to work the blue-collar folk, the people who are carpenters and plumbers and steam fitters and electricians back on the job at the various construction sites. We also are back with manufacturing. Now, Westchester does not have the kind of manufacturing base that other places do. We have small manufacturing companies scattered throughout the county. You'll find a fair bit of them in the urban cores of our county, in Yonkers, Nepperhan Avenue, Sawmill River Road. You'll see them on the south side of Mount Vernon, South Fulton Avenue, South Columbus Avenue, and in other parts of the county. Those manufacturing facilities were reopened as part of phase 1. And that also puts people back to work who work with their hands and generally now can go back off of unemployment and back into a normal productive work. Phase 1 also allowed for curbside retail at our various stores, and those stores basically are now able to satisfy at the point of sale at the store things that people call for, order, and can pick up. We think of it in terms of clothing and other types of retail stores. It involves florists. It involves a wide range of organizations that have previously been completely shuttered that now can open over the next 2 weeks for curbside retail. There's 1,000 questions to be asked depending on the kind of business that it is. It also opens up wholesale trade, agriculture, of which there's a little bit in Westchester, but we're certainly not as agricultural dependent as some of our neighbors to the north. Forestry, fishing, and hunting, similarly, industries that are much more prominent in upstate. But all of those were opened up under phase 1, and every business, both under phase 1 and on the phases that are to come, have to put together a business plan on how they intend to operate using the best practices to reduce the spread of the contagion. The concept that the governor has had in doing this is to open the state slowly, both by region and by type of function, in order to make sure that a flip of the switch opening that could increase the contagion again would put us back where we were at our peak period in late March and early April. And we want to avoid that most obviously. So in this particular case, businesses, those who may be online, who are familiar with how their operations work in construction, in manufacturing, in retail, have put together efforts to determine how are they going to handle curbside retail. What is it going to look like physically at front of their store or their point of sale? And how are they going to handle the men and the women that work on the construction site or work inside the factory so that we don't, again, advance the contagion, which is what this is about. I don't believe that the next 2 weeks are going to be particularly taxing for us, because I think the things that have opened up are the ones that lend themselves the best to making sure that there's social distancing and what have you. If we follow the metrics as laid out by the governor, and we don't have any spike in hospitalizations or deaths or any of the other major indicators, then within a 2-week period of time, which would put us on or about June 9th, we should be able to move to the second phase. And the second phase of opening is much more impactful. It opens all retail businesses, which means all shopping malls, the big malls that we have, strip malls or otherwise, all throughout our county or throughout the region. It also opens up all of the administrative office functions that exist for corporations, the big ones, IBM, MasterCard, Regeneron, PepsiCo, and Heineken, Danone North America, and so many others, but also for the smaller companies, the ones that are real estate organizations, those that are the various businesses that provide accounting services, legal services, anything that represents an administrative function. And that also applies to local governments, that we get back our staff into the offices and functioning. And that puts a white collar base back to business. Now, some of that base of business worked remote, but by bringing them back into their locations, they are now part, along with the blue collar workforce, of the people that can start to patronize the retail facilities that are in and around where these offices are. And then if we can achieve, again, that maintenance through the heart of the month of June, then the third phase that follows brings with it the opening of restaurants, which is probably the single biggest energy for downtown activity in the small communities and the larger communities of the county, the energy of a McLean Avenue, the energy that you find here in downtown White Plains, where I'm from right now, will really come alive when the restaurants come alive. And that, if we stay on schedule, should be June 23rd, if we stay with the 2-week schedule. Now, the governor reserves the right to lift his orders at any point in time, and then also to reimpose them if the numbers aren't there. To the extent that the county has any control over these as a government, the single most important thing we have to do is put a team of contact tracers out into the field, and we've been able to identify and train the bulk of those people. And their mission is basically to deal with each person that might be infected, trace down the contacts that person has had over 14 days, and then with each of those contacts, be able to identify whether or not they need to be isolated because they've been exposed to the disease. When you can do that, and South Korea has done this and it's proven very successful, then you can reduce the amount of contagion. We all understand that this disease has no vaccine in place and has no antiviral treatment for those who get the disease. And even if it affects seriously, 1/5 of the number of people that get it, we don't know which fifth that's going to be. So we have to assume that anybody that's infected could, in theory, get seriously ill, and to some extent, given the number of people that have, could lose their lives. So absent the vaccine, absent the antiviral, the medical professionals say that we have to test, we have to isolate and stop the spread, and that's the best way to contain this. So in the reopening of the society today, and then what we hope will happen in 2 weeks, what we hope will happen in 4 weeks, based on the way the state has laid it out, we would be in a position to start to widen the scope of our operations in the county. Just one final word. We're entering the summertime, so those of us in government have tried to figure out, without bumping into gubernatorial executive orders, how do we provide some of the recreational services that help people who are otherwise out of work or waiting or no school during the summer to be able to have that release, so they channel their energy in a productive way and not necessarily clustering and in a way that would be a problem. So we've reestablished all of our parks being open. Our public golf courses are open. Bicycle Sunday has resumed with certain rules in place. And we've opened 2 of our 3 county beaches with the same intent in mind. We're going to take a look at what can we do with our pool. All of this is to say that we recognize that we have to address the way people are in the real world, understand that all of this is not part of our traditional culture. Wearing a mask is not part of our culture. When I have been sick in the past, I never thought to put a mask on when I went out in public. But now, not to make a political statement, but to stop virus from spreading, we are doing certain things that we would not normally do, social distancing being one of them. We're going to be reducing the size and the scope of usable area to give people enough space between each other. It will be difficult to do in some cases. It will be awkward in almost all cases. But these are the things that we have to do. And if we do them well and we do them diligently, we'll slowly get back to normalcy. We will come back to normalcy, however long it takes. Certain things will change, but we will be able to, I think, get us to where we need to be. We're all a tough people, a resilient people. And as I've said symbolically in a number of my updates, I heard many times, and maybe some of you in my age category have heard the same thing, the stories of my parents of having gone through the Depression and World War II, and how they sacrificed and how they did without in order to conquer both of those two amazing stories. And that's why they were called the greatest generation. And now I recognize that I and we have to prove that we are our father's sons, or if you would, your grandfather's grandsons and granddaughters, grandmothers, to show that we too can rise to the occasion. I think we will. That's what we're in the process of trying to do. And hopefully, as we work through this opening process, we'll go step by step. We'll see the economy start to rally. It will take some time, but we will get back to normal. And we'll be all the better for having been tried and found successful in defeating this virus.
Thanks, George. Thanks for joining us today and for those opening remarks. We'll get to the heart of the program now. We've got experts from Montefiore as well as ENTA and Allergy Associates. But first, I'd like to turn it over to Teresa Buccello from Mercer. She's going to provide sort of a mini keynote, and she'll be our moderator for today's program.
Thank you, Michael. Thank you, County Executive Latimer, as well. We certainly are in a time of disruption and uncertainty. Ryan, you can go to the next slide. Thank you. Mercer is thinking about the crisis in 3 distinct phases: respond, return, and reinvent. They're not necessarily sequential, and companies may find themselves alternating between the phases depending on the course of the pandemic. Respond is really defined by the reactions of companies through the peak of this crisis to protect both the health and well-being of their people, as well as the health of the business. The return phase now is about how people and businesses are going to start to return to what that new normal is. And it's unclear that it's clear that normal will continue to evolve. And so companies are going to have to be adaptive and employees are going to be resilient. The third phase is reinvent. Disruption brings opportunity to reflect, reset, and reinvigorate. This phase is going to be focused on innovation. Businesses are re-examining their models and adopting more sustainable practices. Organizations, in many cases, were forced to quickly embrace new ways to conduct business to stay afloat. Finally, throughout all 3 phases, it is an imperative to engage, listen, and understand the impact to your employee population and their experience. Understanding the impact on employee needs is part of the process and provides information on the potential and the need to reinvent. As we consider return to work, one of the first pieces to really flesh out is who does need to return to a work site. Some organizations, this is going to be more important than others. As we've all heard, the recommendation is to stay remote when possible. So the question is, what functions are essential for you to have on site? This is going to vary drastically by industry and size of the organization. If you have a team of 5 in finance, then maybe you don't need all 5 to physically return to the office to continue operations and run payroll. But maybe someone needs to come in and everyone else can report from a remote perspective. Some employers have actually found productivity has increased in the remote environment, and there's some high-performing teams that have emerged. Next slide, please. As you are making those determinations, though, you're going to have to continue and consider the employee perspective. As you communicate the decision to return, there will be a lot weighing on employee minds. We have some employers right now that are launching pulse surveys and to their employees to really understand what concerns they have. What barriers are they going to face individually as they think about returning? Understanding where your population stands really can help you as you prepare for what the next phase is going to look like. What you see here is an illustration of an employee's journey through the return to work experience. They'll have to get childcare in many cases. They may need to conduct a pre-screening depending on the employer protocols, find safe ways to get to work, and this is going to become even more complicated if they utilize public transportation. And then they'll come to work potentially with new protocols on site, like temperature screenings, new work practices to incorporate social distancing. So if they weren't concerned about the risk initially, there's no question that this will be top of mind as they learn about the new normal of what it means to return to work. Please advance. On top of the health, safety, and logistical concerns, many will be making economic decisions. I've been speaking to many employers about the very real challenge in bringing some people back to work. This is very true for the lower paid workforce. Available unemployment benefits must be a consideration. Due to the supplemental benefit available through the CARES Act, we know that many hourly employees would likely earn more through unemployment than their regular earnings. So if we take two employees, employee A who's returning to work, earning their normal rate of $15 an hour, $600 per week, who has now exposure potentially due to being on site, and may be subject to additional childcare costs as schools and potentially camps are closed through the summer as well. And you compare that experience to employee B, an employee who remains on furlough, potentially through the same employer. We know that individual, depending on the state, can earn anywhere from $840 to $1,080 per week. And of course, having no exposure to potential COVID or no childcare costs. We know that the CARES Act benefit only extends through July 2020 right now, but there are several proposals to extend that as well as providing other supplemental income in the form of stimulus payments. The incentive to return to work quite possibly could diminish even further. Also, while many states will deem a worker ineligible for unemployment if their employer calls them back, we do know that some states have temporarily waived this for employees who have a valid reason of why they can't go back to work. And some will continue to consider this, such as childcare or unsafe work conditions due to COVID. And lastly, while additional employer-provided benefits may be an added incentive for those who are eligible, it may not fully offset the difference in weekly earnings. And right now we know that cash is king even more than usual. Next slide, please. Employees that are returning to work have been impacted in many ways. We're seeing rewards, including comp and benefits, being impacted through some of the cost containment efforts that organizations have had to employ to continue to stay in business. The downstream impact of the stimulus payment at some point will impact employers possibly from a tax perspective and will force employers to make even more difficult decisions in an effort to stay in business as operating costs rise. Employee jobs have been impacted to drive immediate savings. We've talked a lot about furloughs and layoffs, but for many, even returning to work, they may be brought back with reduced hours, potential pay cuts, or participating in job share programs. In Westchester, we've seen large employers furloughing over 1,000 employees. And this clearly has a huge impact on our local economy as the unemployment rate locally continues to skyrocket. Some employers are having to reskill as jobs are reinventing to meet the changing environment. Outside of actions that you may be taking, your employees will potentially be impacted by other job loss in their household or pay reductions, making financial wellness a real concern. We know the direct correlation between overall mental well-being and physical health. Financial stress and avoided medical care can manifest into even longer-term increased healthcare spending. All of these contributing to low employee morale, which impacts productivity and your bottom line. So how do you ensure you're supporting your employees, whether their return to work is continuing virtually or on site? Some considerations may be providing childcare support. This could be in the form of access to resources or even potential funding. Revisiting PTO policies to provide additional paid time off. Emotional health support. This has been a huge topic with my clients, and we're looking at different ways to promote resources within their health plans, their EAP, which is their employee assistance programs, and also looking at revamping wellness programs to help engage people who are all at different places in terms of their recovery and return. Offering flexible schedules, especially with uncertainty around childcare, camp, and even school reopening in the fall at this point, may be needed by many to try to balance the demands of work and their families. This could be compressed work schedules or alternative work arrangements. Next slide, please. Supporting all of the needs of your employee population is critical to your business, but as you're managing all of their new and changing needs, you have to focus on preparing the actual physical work site for return. This includes considering the different ways you can maintain social distancing, keeping a clean environment, following any mandatory testing and temperature checks, and ultimately tracking and reporting as required. You'll have to take extra precautions to ensure people feel safe when entering the workspace while meeting the mandatory requirements laid out to open. While putting these plans together, it is really critical that leadership within your organization play a critical, active role in managing this process and modeling appropriate behaviors. Transparency is key, and ensuring you are setting expectations on what is required and protocols for violations. Next slide, please. As we consider from a macro level, County Executive George Latimer outlined the different phases, which we've outlined here on this slide. But As we think through the different phases, we need to consider the state and county plans, which is going to dictate how we move forward. As indicated, we began phase 1 yesterday as the 8th region in the state. Other areas like New York City, which are very close in proximity, still further behind. It's allowed many businesses to open following the careful guidance that's been outlined by the state. And by the time we get to phase 2, a very significant percentage of those businesses not open today will be. Keeping in mind restaurants in the food industry in phase 3, many are open now but are limited to that takeout and delivery. Phase 4 to me is a lot of TBD in my mind. When we think about the businesses in this sector, you're talking about venues that typically have very high concentration of people gathered and more significant challenges when we think about reopening with distancing protocols. It's likely that some in this phase, unfortunately, may not even be allowed to hold previously scheduled events, concerts, things like that this summer. The bottom line, though, is that with all of these phased approaches, there are very strict guidelines in the areas of physical spacing, protective equipment, hygiene, communication requirements, and screening that must be followed. Next slide, please. There's a lot on this slide. The requirements will vary significantly by industry. Phase 1 guidelines for manufacturing are outlined here. There are separate guidelines published for each sector. With manufacturing and retail serving communities in very different ways, those protocols are going to vary. As each phase opens, new documents outlining the required practices and recommendations by industry are released by Governor Cuomo. When you think about retail, you have to consider contact with customers on a very regular basis. Manufacturing, County Executive Latimer had outlined that, we have some smaller plants in this area. And when you think about smaller plants and distancing in close quarters, this can be very hard if you're on a production line or operating in that small plant environment. As you look through these requirements, the overarching theme is complex. There's an unprecedented amount of work that needs to go into the planning process and many questions that will be open to interpretation when you actually put pen to paper and map it all out. How do you handle common areas? Do you remove water coolers and coffee machines? What about using the copy machine? How do you create more touchless businesses and offices? Can you dedicate a person to operate the machinery? Is this now a new headcount? Repurposing someone on staff, or just an added responsibility to an already stretched employee? Cleaning is going to be hard, not only because of the rules, but supplies. How much more is demand going to increase as businesses continue to reopen? We all know how hard it has been to get some supplies personally throughout this time period. Keep in mind that it's actually a depressed level of consumption today compared to as it will be as we continue to reopen. Are businesses going to have to get creative and start making their own? There are a lot of questions, and whether or not there'll be government intervention to be able to assist with some of these purchases. If you have a building management company, I would definitely encourage you to talk to them about what they're going to do under your contracts to support the efforts. Then you have mandatory reporting, screening. Another new task to undertake. You need to make sure that you're following protocols for reporting back to the appropriate agencies, but also ensuring privacy while managing the data and who has access to it. Being mindful of OSHA, the DOL. There are some recommended best practices under Governor Cuomo's plan outlined here just for the manufacturing industry. And you'll see that throughout all of the industries as you approach those phased reopenings. But as you can see, the amount of mandatory, unfortunately, it does surpass the items just deemed best practices, but all of these very important and required activities. Next slide, please. So where do we go from here? Start by first understanding who needs to come back and answer the why. Why do they need to physically be in the office or on site? And in many cases, there are some very specific answers to that question. And the answer may be yes, and in some cases not. As you determine that, start taking those steps to prepare the work site. Think about all of the small things when you redesign the workspace. They are important. How to handle things like the coffee machine I mentioned earlier, bathroom access, bottlenecking, no more hanging around the water cooler, and how do people collaborate in person safely? The cleaning protocols are going to be equally important in this planning process. Make sure that as you're going through all of these steps, you are communicating and engaging with empathy. Your employees need to feel safe, and they need to believe that you truly have their best interests at heart. Help them to feel, when possible, that they are a part of planning their personal return to work, and that the plan can be adjusted as needed. From a screening perspective, make sure that you understand the different options and the values of each. Keep in mind that these are considered medical screenings, and as such, you need to maintain privacy and confidentiality. And lead by example. Model the behavior you want emulated and keep it straightforward and simple. You don't want to make it harder than it has to be. And I'll say it again, be transparent. When we help others to understand the reasons behind what we are doing and the downstream impacts, you tend to get better traction. When people understand the basis for something, they're more likely to respect the decisions that are made. As you contemplate next steps, I would urge you to consider these important factors. Follow the guidance issued by Governor Cuomo and County Executive Latimer. Ultimately, we're all in this together. Reach out to each other, lean on each other, and share learnings and best practices. Stay nimble, because things will change as we learn more. We're going to need to be able to pivot at times to adjust as guidance changes. Today, we have a great panel that is going to share their experiences and lessons learned to consider as we all move forward together. Thank you. So at this point, we are going to introduce our first panelist, Stephen Rosenthal. Hi, Stephen.
Hi.
Stephen is Senior Vice President for Population Health Management for the Montefiore Care Management Organization. And he is going to spend some time talking about how employers can develop a healthy and safe workplace. Stephen?
Thank you, Teresa. I also want to thank Michael and Amy Allen for inviting me to participate in what I think is a very important discussion. I think many of us who have been challenged by this experience over the last few months, 2 months really, have begun to think about how do we rethink our organization as we begin the process of opening our business. It would be almost a crime not to use this time to begin to actually think about how and what we have learned during this period of time about our business and put those opportunities in place. Some of those opportunities were discussed briefly about who could work from home versus not, but a whole host of opportunities beyond that. I think it's the perfect time to think through that. Most of us are in the process of rethinking how do we revive demand? Because without demand, we can't revive revenue. And the opportunity is not insignificant. In healthcare alone, as you can imagine, we've been challenged by the changes in revenue associated with this virus. And working our way through that, we're beginning to learn opportunities and new ways of doing things that perhaps are better and more appropriate as we move into the future. Let me just ask for the next slide. So what I'm just going to briefly talk about today is a little bit about Montefiore's experience, our thinking around employers returning to work and thinking about reopening their businesses, and just some overview of some of the health and safety items that need to be considered, but more importantly, how to move forward. I think at this particular juncture, as an organization of employers and businesses, we really need to think about the doing at this point, because we've been suffering a great deal of challenge in the last 2 months. Next slide. I show you this really more to show you that Montefiore has made an enormous investment in Westchester and the Hudson Valley. And as partners, as was just mentioned by Teresa about working together, we believe very strongly that it's important for us to work with the employers that we service both clinically and at the same time help you return to whatever normal business might be for your organization going forward. And so our influence in our business stretches a significant portion of the Hudson Valley, and working together is really the great opportunity of this potential pandemic, and thinking through how we can benefit from one another's experiences. Next slide. As you can imagine, the Bronx became a hotspot in New York State for COVID, let alone our experiences in our Westchester facilities and the involvement throughout the Hudson Valley. You know, thinking back on March 11th, I think we had 2 positive COVID patients in the hospital. And then on March 31st, we had over 2,000. So that fast ramp up, that movement, that change in environment is an amazing learning experience, let alone a physical and emotional challenge, particularly when you have 40,000 employees that you also have to think about protecting and managing during that experience. And how does one begin to create those kinds of programs and basic essential elements to create that safe working environment? So we've learned in the strength of this enormous undertaking of managing this surge in this virus, all of the important things to deal with for both your customer, in our instance, patients, as well as your employees. We actually had to begin to think about how do you communicate with your employees when they're not feeling well, particularly when you have so many. So we created a nurse and clinical support phone line supported by technology that allowed us to have our employees call in and describe their symptoms to a clinical person, and then that person would make a decision based on their clinical discussion about what needs to be done for that employee. And some of the challenges that many of the employers are having around things like testing, which I'm sure we'll talk a little bit about, has been what is the most appropriate test, and at the same time, what are the guidelines that I should be using for managing when my employees should or shouldn't be coming back to work. And interestingly enough, the challenge we're having is that New York City has a different set of requirements versus New York State versus the CDC. And so what's most important for your business, and what do you think is the most relevant decision to follow at that particular time? And who's going to give you the guidance around what makes the most sense? Clearly someone with a great deal of experience. We've also had to create programs to train our staff. We had to have people who understood how to use protective equipment. It's not something that perhaps other than maybe a surgeon would have known, but many of those of us who don't see patients on a regular basis were probably putting the equipment on inappropriately. And so we had to be trained and work through those trainings. And as a result, because we have such a large community of employees, we had to create training programs that were digital, online, and become available in a broader scope to those of us in our communities that we can support. So our goal has been, how do you work with the employer community, as we've done with ourselves, and begin to create that strategy for how you bring your employees back? Because the critical element of this is a plan. All of the things that Teresa pointed out are all relevant, but as an employer with X number of employees, whether it's an employer that has employees that don't interact other than telephonically with their customers versus a restaurant or a hotel, these are challenges that perhaps are not always available in the skill set of the staff that you have on board. So having an organization that's been through this with this skill set and has developed a business model around this could be very helpful for many of our important constituents in Westchester and beyond. Next slide, please. So when we think about some of the challenges with regard to the return to work priorities, we focus on the health and safety issues and how they need to become part of your businesses or the business's infrastructure. How do you demonstrate to the state that your business is really ready to be open? If we are unfortunate enough to have a resurgence in the virus, as many individuals have been predicting for the fall, how do we maintain a safe environment for our employees during that period of time so there isn't necessarily a requirement to shut everything down? What are the guidelines, and how does one demonstrate to the state that you're effective at protecting your customers and your employees? And then how do you assure that there's some business continuity to those not affected by the employees' poor health, and how do they play a role in that community? The health and safety operational strategy that you develop, as I mentioned, really has to withstand all of those future outbreaks that may or may not occur. And if you think about it, if you're involved in that service, in that activity already, and you're thinking about all of the things that could be coming down that road that affect us as individuals, well, the flu season is going to be coming back again as well. Should we be incorporating with the testing model flu injections? Should we be incorporating other clinical services that are wellness oriented in that process while we're beginning the protection process for our customers and our employees during the development of these programs? And if you think about it, the customer really has to have a level of comfort to do business again. And so how do you create that level of safety? Having an organization that's partnering with local clinical and healthcare systems that have a reputation of having been very successful in managing challenges like this gives you an opportunity to essentially declare that there is this so-called good housekeeping seal of approval, so to speak, not specifically, but generically and through association. All important as we begin to think about that level of confidence that individuals need to have to continue and to renew doing business again. Next slide. On this slide, I tried to kind of really just briefly speak to some of the major safety and health items that as an employer you need to consider. Not to go into detail here, but to understand that this is a complex undertaking, and that collaborative help and working with organizations with that level of experience and who are focused on this now, like we are, would be an opportunity for folks to begin to think about that transition in a more long-term and graduating process of how one goes through the rest of this year and what does 2021 look like. So health and safety exposures, obviously, those are the things that just generally happen on the job. How do we create that safe distance in the workplace? How do we begin to educate and put the safety devices like masks? And how do we begin that process of beginning to test our employees? And there are different schools of thought on testing. You know, there's the traditional testing that began very early in the process, which is the RPA test, where there's actually a swab that's used in the nasal passage. And then there's now a saliva test to do that. And then there's the antibody test. The antibody test is really a reflection of history of things in the past. As an employer, and to protect your employees and your employees, you want to know what's happening at the moment. So perhaps the kind of testing that tells you whether someone actually has the virus today is the most important test. And do you test everybody? Do you test everybody on a regular basis? And what are the right approaches to handling that? And how does one begin to develop the capability to financially manage those challenges? Because many of us have been really hampered by the loss of business over the last 2 months. Obviously, we're very focused on our employees and beginning to think about what's important for them. I think Teresa's point about a collaborative approach is critical. They need to feel as though they're part of the process so they understand the process. So coming back to work is not something that creates fear. And then, of course, there needs to be a focus on your facilities. How do people enter the facilities? Are we going to be testing their temperature every day, giving them face masks, and making sure that as they sit and work, if they come back to the facility, do they sit and work in an environment where they're safely distant from one another? Staff training becomes critical, developing programs to make sure that staff understands how to use equipment, and how to ultimately participate in the process. And many of these programs are available, some of which we've created and others have created to really provide that level of education. These are not difficult things to learn, but they do have a process. One of the things that we've learned in this process is that you need to support both your employee community and their related families, recognizing that the stress associated with this has created a great deal of behavioral health issues. And supporting them with behavioral health and wellness is one of the things that we've expanded dramatically using telehealth and all kinds of technology platforms to meet people in any place that's comfortable for them. Making sure that they've had all their wellness related services will obviously help us prevent any comorbid and or challenging conditions that should someone get the virus, which only makes managing the virus for the clinicians that much more challenging. We've also learned that individuals who have had the experience of having the disease, having the virus, having it in a significant fashion where they've been intubated and been in the hospital for a number of weeks perhaps, when they come out, they're significantly physically debilitated and need some rehabilitation. So we have actually created programs with local physical therapy support by a large network of physical therapy providers to keep people and to restore them back to a level of functioning where they're comfortable in the work environment. And then lastly, it's really important for us to begin to consider what's important with regard to technology. We're mostly concerned about what I think County Executive Latimer pointed out about tracing, making sure that we understand who's impacted by what, and then being able to communicate with them so we can actually quarantine them for that period of time and make sure that we're not spreading the virus. Next slide. So really just about moving forward, it's really important, as I said earlier, that you really need to understand that there's a complex environment going on around regulations and guidelines. They're ever changing. We don't really know everything there is to know about this virus. We're learning every day. As you've probably have become aware, the guidelines pretty much change every day, sometimes more than once a day. And we really need to have a plan and a reopening plan that takes us through the balance of this year, by industry and by phase, as the county executive pointed out, and begin to think about what does 2021 look like as a perhaps defining year as we move back to a more full experience of the level of business that had preceded this whole pandemic. Safety plan outlining the business, we kind of discussed. The spread of COVID needs to be really managed so that we don't have future recurrences. Monitor the compliance so that you can demonstrate that you're doing what you've said you've planned to do, and begin to really inform your employees of what you're about to do so they understand what phases mean to them, when they could potentially be rehired if they're not currently working, and certainly where that business is heading over time is important for them to understand. So participating and making sure they feel comfortable coming back to that work environment is a critical experience. And I'll turn that back to you, Teresa. I think that's kind of where I'd like to end.
Great. Thank you so much for sharing, Stephen. Very helpful. And I really think, thinking about the health and safety of the workforce from a holistic perspective is key. As we're talking about their overall well-being as well. So just wanted to ask a couple of questions. One of them, you talked about screening and testing a little bit, and wanted to get your thoughts around employers mandating testing when entering the worksite. As you had stated, considerations are for the employees, right, and staff that an organization has, but in addition, depending on what type of business they are, that will also dictate whether or not customers and patrons are comfortable coming back, understanding kind of what protocols have been put in place. So would love to hear your perspective on kind of that potentially mandating testing.
Well, mandating obviously is a strong word. Everyone often has the right to make a decision, but then the employer has the right to make a decision on those individuals who have chosen not to have an exam. I think from the perspective of coworkers and potential customers, if we don't know whether the individuals who are actually interacting with you are not positive or not, I think there's always a risk of spread. So clearly there has to be a plan and a policy in place that says at the beginning of this, all of my employees need to be tested so that I can understand who is or isn't an active with the virus. Those who are active should be under quarantine for the appropriate number of days until they're better, so that they're protecting and are being protected by those employees who aren't yet infected. So I think there needs to be a policy, and I think even that everyone may be tested on in that first moment in time, probably also needs to be some regular period of testing for individuals, particularly those individuals who might develop symptoms.
Thank you. So kind of keeping along those lines and helping an employer and business think through that return to workplace plan, is, how can a hospital system such as Montefiore help support them? You mentioned kind of partnering, right, with an organization that really has had experience and has had to employ measures to arm employees with PPE, the way to utilize them, methods for testing or temperature checks, things like that. So how can an employer get information around partnering with a health system such as yours and others? And is it scalable for an employer with multiple locations around the country?
Well, being a hospital system is one issue. I kind of often view Montefiore really as a large health system that has hospitals, but it also has over 8,000 providers within the system that span both the Bronx and the Hudson Valley. And I think what we've tried to do is create a separate division purely focused on taking our knowledge and transferring it to the employer community for two reasons. One is it's important for us as a major investor in the well-being of the communities within the Hudson Valley to be a good neighbor and to be a good partner. And then secondarily, it's really important for us because we're very actively involved in trying to contain a virus and working through what might be, for example, a vaccine. Montefiore was the lead in the analysis of remdesivir, which is the current drug that people are very hopeful about. We're doing a number of clinical trials. So I think passing the knowledge and also establishing some of the guidelines that are being used by various compliance agencies makes us really the expert, so to speak, in that level of change. So clearly an important potential partner for businesses.
Thank you, Stephen. And I know as we move through this conversation, there are some organizations that have asked, how do we get in touch if we would like to partner? So maybe we could share that information after as well. One more question that I have, and then we will move on with our panel. So from a healthcare perspective and healthcare cost perspective, many self-funded employers that we are partnering with right now are in the process of trying to project healthcare costs for the remainder of 2020. Obviously, utilization has changed significantly this year. And there's absolutely this thought process that there will be a rebound in care deferred earlier this year. So curious, as Montefiore Health System is forecasting for the rest of the year, how much additional capacity exists to catch up on all the care that we missed, and kind of how are you guys planning through those considerations?
Well, first of all, there's a fairly significant question as to what has been missed and what's pending. We know that there are a number of individuals who were, for example, scheduled for surgery, that the surgery was delayed. We know that there are individuals who, for example, had cancer, and we know that they were delayed in some of their treatment because of this. But I think in general, you're going to find that a lot of the patients who perhaps use the system in ways that are something less than emergent will continue to stay away for a period of time. So we're thinking that the process will be much more gradual, certainly for the balance of this year, as more and more individuals become more comfortable. But it's also the opportune time to rethink some of the things that perhaps we can do better. And I think that's the most exciting part of this potential disaster that's occurred over the last 2 months, is that what have we learned? We've learned that it's important to focus on individuals who have significant chronic illness. It's important to deal with them in a much more complex way than just the immediate benefit of either a surgery or a medication, but a holistic approach. So our population management strategy tries to look at the longitudinal view of a patient. It's an opportunity for us to become more engaged in that process with both the employer community and the individual patients that we care for, in rethinking how they actually get health care. There's a lot of services in their neighborhood, and there's a lot of opportunity to get things done where they live, and beginning to think things through a little bit more proactively with employers, I think, is an amazing opportunity. And I think that will help keep employers' costs down and then gradually moderate it as time passes. But I think there are opportunities to be ahead of that stream if we plan now.
No, thank you, Stephen. And I think, and thinking through as organizations have learned to operate differently, and health providers in particular, that the surge in kind of virtual care and telehealth is definitely going to be, I think, another one of those opportunities, right, that we're going to see evolve and change and potentially have create opportunity for more people to access care in different ways. So thank you.
Absolutely. Yeah, I mean, I think you're absolutely right. I think telemedicine took an enormous leap in the shortest time that one could have conceived. It was in the works, but it really became a part of the culture in literally 2 months. And with thousands of visits using that technology going on every week, there's a lot of experience. And quite frankly, people enjoy it. It's very convenient, particularly if they're getting the outcome they want. So I think there's a reason to be in front of a physician, and there are times where it's not necessary.
Absolutely, thank you. And I think that speaks to kind of the opportunity for providers to potentially see more patients in different settings, and also the ability to help control costs from a healthcare perspective and from an employer or health plan perspective. So thank you so much for all that you shared today. So at this point, we are going to transition over to Eric Seidel. Thank you, Eric, for joining us. Eric is the Senior Director of Human Resources at ENTA and Allergy Associates. They were one of the first employers in the region to reopen fully, and is going to share some best practices and lessons learned as they went through their planning process and the eventual reopening, which has been a couple of weeks now, actually, I think. So thank you so much for joining us, Eric, and I will turn it over to you.
Thanks, Teresa. It's a pleasure to be here and to share some of what we've learned and what we've seen working for us as we have expanded our practice. Let's move ahead to the first slide, please. Just briefly today, want to talk about what our journey has been with a little bit of background as to where we were prior to all of this starting, to provide some perspective on the impact that it had on us, as it had on most other businesses in the region and across the country, if not the world, what that impact has been, and then what we did as far as our phased reopening, but really more of a scaling. As an essential business, we never fully closed, but we did scale back significantly, which I'll go through. As part of that phased reopening and scaling back up, I'll talk about some of the steps we've taken for employee health and safety, ensuring patient safety, of course, and then our plans for looking forward. Next slide, please. So again, just to provide some background on the practice and our role and our scope, we are the largest ear, nose, throat, and allergy practice in the country. Prior to all of this, our 220 physicians were seeing about 90,000 patient visits a month across 46 clinical locations in the Metro New York and New Jersey area, including near all 5 boroughs of New York City. We have 125 audiologists. We have over 100 licensed allergy nurses. And we're using online web appointments and a staff of about 1,200 employees in addition to our physicians taking care of all these patients. So it's a large operation spread out across a fairly large footprint in the region. And a lot to, I understand there's some issues with the audio. I apologize about that. So you can see on the screen a little bit about where we were. Let's move forward, and perhaps the audio will clear itself up as we go. With the pandemic rearing its ugly head, our patient volume dropped over 70%, seemingly overnight. With elective surgeries and procedures canceled, most of our patients stopped coming in, and our work dried up. Our online web appointments dropped by almost 2/3, and we ended up having to close all but 7 of our offices. We kept a regional presence with limited hours and limited clinical services to treat the most emergent cases of the patients who needed allergy shots, for example, each week, and truly those who were suffering from COVID-related symptoms and needed care immediately. On the administrative side, looking at our corporate headquarters with over 300 employees, we instituted a strict work from home rotation policy, which came with technical and management challenges that we had to deal with on the fly. Salary reductions, reduced hours schedules and transfers, and ultimately furloughing over 800 employees. So quite a large impact on our organization, but we took these steps to make sure that we could stay operating and continue seeing patients as we continued. Again, I apologize for the audio issues. I'm just going to keep going, and hopefully you can hear me and get the content from the slides. Let's move forward. In responding to this and allowing ourselves to in responding to COVID and planning for our reduced operations and then ultimately being able to scale back, we created a COVID-19 task force from individuals across our organization, our board, our director of OSHA operations, and our physicians, obviously, our allergists and infectious disease specialists who have special knowledge in this area. We created and implemented telehealth products, which we had never offered before. And as I mentioned, we implemented work from home and rotation policies for our corporate and administrative staff. We reduced our operations, as I said, from over 40 offices down to 7, but then quickly opened allergy shots in 30 additional locations as quickly as we could, again, so that we could continue meeting our patients' needs for the most emergent cases. In the next phase, towards the end of April, we brought back approximately 150 employees and then expanded to opening all of our clinical offices with limited hours and limited staff, and enhanced screening procedures for patient, provider, and staff safety, which I'll talk about a little bit on the next slide. Our next phase going forward, I'm sorry, let's go back one more, apologize. Our next phase going forward now is bringing back additional staff in phases on both the clinical and administrative side, expanding clinical hours, and increasing patient per hour limits in a safe way, both for patients and for staff, resuming our audiology services, and planning for, again, continued but safe scaling back up for continuing to see as many patients as we possibly can. Now let's move forward. For employee safety, we have some measures that we put in place for all of our locations, and then some specifically for clinical and corporate. Certainly enhanced cleaning and sanitation practices, temperature checks, health screenings for staff in all of our locations, corporate and clinical. Imposing social distancing guidelines in the clinical offices as well as our corporate office. This benefits patients as well in the clinical offices. And for corporate, we are fortunate that within the past year, we moved into much larger space here in Tarrytown, which allows us to spread out for those of us who do still come into the corporate office. A key piece for us has been regular communication regarding these policies, protocols, and best practices. As I'm sure many of you are experiencing, and as we've heard from Teresa and from Stephen, employees are scared. They're scared about venturing out of their homes. They're certainly scared about returning to work. So trying to be as proactive as possible with communication about what we're doing, when we're doing it, and what it's going to look like can really help with managing the fear and helping smooth the re-entry and reopening pathway. And finally, the clear instructions on who to contact in the event of a possible exposure. That would be either for in the clinical office or for our employees who may be exposed outside of work, their family member or friend, or their own travel. Again, in our clinical offices, we have extra safety protocols for patients, which have the nice benefit of protecting our staff and physicians as well. And we are providing all necessary PPE for our entire staff. In the corporate office, again, we're still maintaining work from home rotation. We only have about 30 to 40 people out of 300 coming into the corporate office at any one time. And we've replaced all in-person meetings with virtual meetings and similar uses of technology to keep that distance for everyone. Next slide, please. A little bit further information on patient safety. We, as I mentioned, have implemented telehealth and virtual visits for those patients who either can't come in or don't necessarily need to come in. But many of our patients do need to actually be seen, and that's really where our physician's specialty and abilities are most valuable. So for those who do need to come in, we've limited our in-office visits in terms of the number per day and the number per hour. We do advanced patient screening both over the phone and at the door when you arrive. We are taking temperature of patients who do come in. We're actually allowing patients to stay in their cars until it is their time to be seen. We text them when they come in so that they don't have to crowd into the waiting room with other patients who may be sick, regardless of what they have. Masks are required for patients, and any, if a parent comes with a child patient at all times. As I mentioned, we're doing temperature checks, and we are enforcing social distancing in all of our locations, both when patients are present and for the staff in the employee-only areas. Next slide, please. So, as I mentioned, our patient volume dropped approximately 70%, very, very quickly. As of today, we're back at about 50% of patient volume where we were this time last year, and our forecasts have us returning back to 70% by October. Interestingly, the 50% is different across the regions. In our more suburban regions, the patient volume has returned more quickly. In our 5 Manhattan offices and our other New York City offices, we've certainly seen slower return of patients. Thankfully, we have a large enough footprint that this is balancing itself out a little bit, but the needs are very different depending on where our offices are located. As Stephen mentioned, it's important to know also about the requirements of local health organizations as well as the state and national level. And also for our own individual landlords, each landlord may have its own requirements about patient volume, elevators, other requirements and that sort of thing. So there is a bit of an imbalance, but we are looking to manage all of that and move forward as quickly and safely as we can. The 3 main factors impacting our return and our growth are the New York State and New Jersey reopening timelines, the reopening of ambulatory surgery centers for elective procedures, again, still not happening and still impacting our business and our patients' needs seriously, and schools reopening, both in terms of children and their health issues, which may need to be treated, but also in parents' ability to come in themselves or bring their kids into the office. Of course, these new health and safety protocols that we've put in place are likely to be permanent, certainly unless and until there is a vaccine for this situation. So I'll stop there, and Teresa, I think you have some follow-up questions for me.
Thank you, Eric. I appreciate that. Thank you very much for sharing. I do apologize. I know that there have been some comments coming in. We have had some challenges with feedback. And I promise you that we tested this multiple times, but sometimes technology is unpredictable. There will absolutely be follow-up coming to everyone when we conclude from WCA directly with the slides and extra resources available. So there'll be an opportunity for you to have this information after as well. I did want to ask a question of you, Eric, as we're wrapping up. So it sounds like you guys worked very hard to create confidence with your employee population, to help them to feel comfortable coming on site. A lot of that had to do with communication and sharing kind of the protocols that were in place. I'm curious, was there anything kind of lessons learned as you were planning, things that you didn't necessarily expect during that process as you were creating confidence? Any barriers that popped up that you weren't necessarily prepared for?
Sure, that's a great question. One thing that we, I think, underestimated a little bit was our employees talking to each other, even those who were on furlough. So as soon as any bit of information came out, it was shared more broadly than we may have intended at that moment. And we then quickly realized that we needed to have a much broader approach and give more information out at each step along the way, both to address that particular issue, but also because our employees deserve to know whether it was their turn to come back or not. They should be hearing from us directly what the plans are. For example, many of our employees are also our patients. So some of them received information that patients received about our safety measures before actually hearing from us as the employer. That was a mistake that we made. So we quickly worked to coordinate that better and make sure that our employees had that information in some cases before our patients did, or before they would have received it as patients. So thinking through all that, there were a lot of other specific issues for specific roles, and some even site-specific, offices that are smaller than others, or spaces within offices that are smaller than others. And as comprehensive as we tried to be, there were a few instances where we had not fully thought everything through, or at least communicated everything through. So trying to be as comprehensive as possible. And I think Stephen mentioned surveys. I think is something we could have done a little bit better with as well, trying to get a sense of the concerns that our employees had from their own mouths.
Great, thank you. And that's a great point, and definitely something I've been a lot of the employers that we are working with as well, to really trying to get that pulse on the employee population so you can address those things ahead of time. And really appreciate all that you've shared as being one of the first employers to really fully open. I will ask one more quick question, and then we're going to turn it over to the Q&A. In terms of, I know you guys did mobilize pretty quickly, and being a healthcare provider, really were in a unique situation compared to some of the other employers that are on the call today, really, in terms of how quickly did you potentially need to get people back into the office to ensure that there was continuity of care. So I'm curious, when we think about, the return to worksite strategy, at what point did you guys pivot from kind of, at some point, in the future, we'll get there to, it's now, it's time, we have to go?
It's really driven by patient volume. Our call center stayed open, our ability for patients to make a web appointment stayed open, and we've been driven by the patient demand. As patients are willing to come in, we are pivoting to make sure that we can accommodate their needs. We have put protocols in place so that we can do so safely, and we've communicated with our physicians as well as our staff about what the next phases might be, and we're really letting that patient volume, drive us as the demand increases and we can't accommodate the patients in the schedules that we've set. We expand our schedules to allow for more patients to come in, still in control and safety.
Great, thank you so much. Really appreciate you joining today, Eric. So I think at this point we're going to move over. I know we've run a little bit over, but we do want to give a few minutes to answer some questions live. There have been quite a few coming in. There's some that we'll be able to answer live, others that we will either send via chat or a follow-up after we conclude today. So thanks for everybody who's hung in there with us too. So I will move over to some of the Q&As that have come in. So one of the first, and I will kind of pass around based on area of expertise. So I'm going to jump around a little bit here. So one of the questions, and I don't know if we necessarily have a guideline on this, but maybe best practice, Stephen maybe can share. But one of the questions is, will an employee who previously tested positive have to be retested before returning to the workplace? So I think the question is, well, is it a requirement? However, I think, Stephen, maybe you can share in terms of thoughts around whether it should be a requirement or kind of what that best practice should look like.
Well, on some level, it somewhat depends how long ago the individual was tested, and I'm assuming the testing was negative, but if the testing was certainly positive, hopefully that person has obviously recovered by then. But I still think that at the point it would be useful to have a baseline, because we don't know whether if you've had the disease before, the virus, whether the immunities actually do protect you from getting it again. So in order to have some level of security on that, I would kind of still recommend that they all have a baseline, unless they were tested 2 days ago or 3 days ago, from the perspective of the employer.
Great, thank you. Thank you, Stephen. Moving on to a couple of other questions here, and I don't know that I personally necessarily know the answer to this as where we stand today, and happy to see if Eric or Stephen may. However, there's a question around the contact tracing and whether or not businesses are expected to require contact info for all patrons. I can tell you that I am not certain at this point if that has been released by Governor Cuomo. I did see some information, some areas like New Orleans the mayor of New Orleans has stated that they are going to require businesses to collect patron info so that if there is a known case that someone may have been in contact with, that they'll be able to provide that information for tracers. I don't know if Stephen or Eric, if you have any information regarding that.
I don't know specifically about the regulations in the healthcare field where we have that information anyway, though. So I mean, we always are tracking the patients who are coming in. So I couldn't speak beyond our industry.
And I think also at this particular juncture, this is the kind of process I would think that should be somewhat centralized and standardized. And so we're hoping that the governor will actually create a process that will be standard, because if everybody is employing different measures and different technology to look for that opportunity to see if they're tracing the right person, I think we're going to find a hodgepodge of information out there. So some standardization and some leadership around the selection of the technology, I think, is essential to move forward. As many companies are now trying to introduce technology, if we have a variety, we're not sure how accurate things are. So I think some centralized leadership would be really important.
Thank you, and very much agreed there. And I think that it gets to kind of not only the technology and kind of methods and tracking process, but also just from a requirements perspective. I think about kind of I think about people's personal feelings about that type of information too, right? And when we enter a restaurant, and some people are going to be very open because they'd like to get that phone call, right? Or potentially know that there was an exposure, and there are going to be some people that are going to feel very much against it. And although they may still feel very much against it, if there's a legislation that requires it, at the same time, it's a little bit easier for businesses to manage that. And I think often when I go to the store, and I feel awful hearing a store manager having an argument with a customer over wearing a mask, right? And just so I would definitely agree that some guidance there would be very helpful. And I think from a timing perspective, I think we have one more question, it looks like, at this point, that we will answer live here. So the question is, I know it's hard to predict future, but with diseases changing and adapting to us, do you see these new practices for safety and spacing being more the new norm? And I think we've all actually shared a little bit of that and how we spoke, but I think it's a really it's a really important topic, and I would love, I think probably we could all chime in there. So maybe I'll turn it first over to you, Stephen. You're on screen to be able to share your thoughts around kind of the new norm and what may stay and what may not, and then Eric, please feel free to jump in.
Well, I think, social distancing, wearing of masks outside when you're not necessarily appropriately distant from somebody, and getting some regular indication of whether you're not currently harboring a virus or the virus. I think that'll be the norm for a very long time. Until there's a vaccine, and the vaccine has demonstrated some success. We may have a vaccine earlier than we thought, but under the same token, it'll take a while for people to feel a level of confidence that that vaccine is actually protecting them. So I still think this will be with us for a while, and perhaps it's not a bad norm to have in place for the next 18 months or so.
I think the confidence piece, both for our customers, patients, and for our staff, is a really important one. Even if the science might before relaxing some of these, I think it's just a good practice to keep it as much of it as makes sense within the spaces that we have. You know, we've seen other flus, we've seen other things coming. Who knows what may be coming down the pipe some other day. You know, we maybe can relax our guard a little bit, but I think some of these things just show that we're staying on the forefront. Similar to, you know, we're going to keep remote working, you know, to some extent, which we never had before, and we never really anticipated doing. So things like that, you know, which are not even specifically tied to the clinical location, I think are good practices, and we're certainly going to see that continue, you know, in workplaces across the country and the world.
Thank you, Eric. And I would agree. I think that when we consider all of the, you know, kind of the obviously very unexpected nature of kind of the predicament we're in today and this pandemic, there are a lot of concerns around, yes, what's to come, you said, right? And is it, you know, are there things that we can keep in place long term that will help us to better prepare for controlling a contagion spread? And, you know, in addition, you know, we've talked about kind of businesses that have reinvented themselves or starting to reinvent themselves and looking at best practices, which may not necessarily just pertain to the health and safety of the workforce, but also maybe better ways for them to do business. And they may need to make changes to continue with some of the economic challenges that they're going to face. So whether it is keeping people remote and reducing their footprint from a physical perspective, or whether it is kind of looking at different ways to control costs that will be able to better help them to support their workforces and their customers. So we thank you all. Thank you, Eric. Thank you, Stephen, very much for participating today. Thank you to everyone that's on the phone. I am going to turn it over to Michael for some closing remarks.
Thanks, Teresa, and thanks to all of our panelists for participating today. A special shout out to Eric, who powered through all of the technology challenges. Guys like me who grew up with Battlestar Galactica, Eric would make a great Cylon. So maybe if they reinvent that series, he can come back on and do that. A couple of quick takeaways. One is that, you know, there's a distinction between what's going to be a legal requirement and what best practices for these organizations are going to be. And the legal stuff is really going to come out of Albany and the CDC and, you know, the county executive's office. So we don't know what that's going to look like, but needless to say, that's a political calculation that's going to be informed by the best practices by the experts like the folks we've got here today, and CDC guidance as well. You know, the second thing is, and most importantly, if we have a rebound or a second wave, hopefully this won't be sneaking up on anybody. And by then we will have our protocols in place, we will have our practices in place, we'll have our guidelines in place, and we will know and be better informed about what to do if that happens. And some of the stuff that we heard today about, you know, making sure you've developed a strong working relationship with a local healthcare provider. And even if you're a small organization, your benefits coordinator or the folks that are in your HR department can reach out and start doing some of that. And be proactive, make sure that you're cooperating and you're communicative with your employees and your customers, and if you're a landlord, with your tenants as well. So with that, I'll wrap it up. We will have the presentations available on our website. Everybody will get a link. In addition to the presentations, that will link to this questionnaire I mentioned at the top of the show, so that you guys can have a direct impact on the work we're undertaking for the future of Westchester. Please stay tuned for additional programs in this reopening event series. More information can be found on our website and on our newsletter, and also on Facebook and LinkedIn. One last shout out to all of our event sponsors, and a special thanks to the county executive for his opening remarks today. Lastly, everybody out there, please stay healthy and stay safe. Thanks.